Today, we're talking about something that sounds like it's straight out of science fiction. Could a weekly injection be the key to treating one of the world's most common and, frankly, most debilitating sleep disorders? Well, a brand new study suggests this might just be our new reality. So let's dive in. I mean, just think about it. Forget the whole nightly routine of strapping on a mask or facing the idea of surgery. What if the answer was a simple weekly shot? This isn't some far-off dream. It's the incredible potential at the heart of a major new clinical trial, a breakthrough that could literally offer hope to millions of people. Now, to really understand why this research is such a huge deal, we first need to talk about the scale of the problem. We are talking about a silent epidemic that affects a staggering number of people, many of whom don't even know they have it. Over 900 million people worldwide. Just let that number sink in for a second. That's the best estimate we have for how many people are living with obstructive sleep apnea, or OSA. It's an absolutely mind-boggling figure, and it makes OSA one of the most common and most undertreated chronic diseases on the entire planet. So what is actually happening in your body when you have sleep apnea? Well, you can think of it as a kind of mechanical failure. As you fall asleep, the muscles in your throat relax too much, and the airway literally collapses on itself. This blockage sets off a chain reaction. You stop breathing, your oxygen levels drop, and your brain basically has to jolt you awake just enough to start breathing again. And this happens over and over all night long. And this is where things get really frustrating for so many patients. You've got the CPAP machine, which, yeah, it works, but it can be really tough to get used to, night after night. Other things like dental devices, they don't work for everybody, and surgery is a huge step. But here's the most glaring problem, the biggest gap in our toolkit. There are absolutely no approved medications for OSA. Zero. This leaves millions of people without a really great long-term option. Okay, so if we can't always fix the mechanics of the airway directly, what if we could attack one of the biggest risk factors? This is where our story takes a really fascinating turn, and it leads us to a medicine that was never even designed for sleep. For a long time, we've known there's a super strong link between excess body weight and sleep apnea. Those fat deposits in the neck and around the tongue can physically squeeze the airway, right? Making it way more likely to collapse when you're asleep. But here's the most important word on this slide: reversible. It's a risk factor we can actually do something about. And this is where Tirzepatide enters the picture. You've probably heard of it. It's a powerful drug originally made for weight management that works with hormones that control your appetite. And the hypothesis here was as simple as it was brilliant. If this drug is really good at treating obesity, could it, by doing that, also fix the sleep apnea? It's a fantastic idea, right? But a hypothesis is just an idea. You have to prove it. And to put this theory to the ultimate test, researchers designed a massive international clinical trial. It was called the SURMOUNT-OSA study, and it was a really big deal. They followed hundreds of patients for a full year, tracking every little detail to get a clear answer to that one big question. Can Tirzepatide safely and effectively treat sleep apnea in people who also have obesity? Now, the design of the study was actually really clever. They split everyone into two main groups. First, you had the people who were not using a CPAP machine, maybe because they couldn't or just didn't want to. Then you had the group that was already on CPAP and planned to keep using it. This was smart because it let them see how the drug worked in two very different but very real-world situations. So, the moment of truth. After a year of treatment, what did the numbers actually show? Well, let's just say the results weren't just positive, they were absolutely stunning. Take a look at this graph. It tells such a powerful story. The blue line at the top, that's the placebo group. As you can see, their sleep apnea barely changed over the year. Now, look at that orange line, the Tirzepatide group. Wow, the number of times they stopped breathing each hour just plummeted. We're talking from about 51 events an hour all the way down to 27. That is a massive, life-changing improvement. So what was driving this incredible change? Well, this second graph gives us the answer. The drop in sleep apnea events almost perfectly mirrored a huge drop in body weight. On average, participants lost nearly 18% of their starting weight. That original hypothesis, it was totally right. And get this, for the patients who were also using a CPAP machine, the results were even more impressive. They saw a nearly 60% drop in their sleep apnea events. I mean, clinically speaking, that is a gigantic improvement. It shows the drug works great on its own, and it works great when combined with the current standard of care. But let's bring this back to what it means for a real person. For up to half of the people in this study, their sleep apnea got so much better that they might not even need to use a CPAP machine anymore. Just think about that for a second. That could mean freedom from being tethered to a machine every single night. These results are so much more than just promising. They could signal a huge shift in how we even think about treating sleep apnea, moving away from just managing the symptoms to actually getting at one of the root causes. And this really shows you how remarkable this treatment could be, because tirzepatide doesn't just do one thing, it seems to offer a more holistic solution. The study showed it didn't just help with weight and breathing, it also lowered the body's oxygen deprivation, reduced inflammation, and even brought down blood pressure. It's tackling all these related cardiovascular risks at the same time. Of course, we have to be balanced here. No study is perfect, and it's important to look at the limitations. We still need to see what the effects are over the long term. And this study only looked at people who had obesity, so we don't know how it might work for others. This is a massive breakthrough, for sure, but it's also the starting line for a lot more research. And that brings us to the final and maybe the most exciting question of all. We've known forever that obesity and sleep apnea are two of our biggest health crises, and they feed into each other in this awful vicious cycle. This study suggests that for the first time, we might have a single tool to fight both of them at the same time. And that is a prospect that could truly change the face of medicine and the lives of millions.